As I was growing up, I always knew I wanted to go to Clemson, and once I got into high school, I realized that I wanted to be in the medical field and help people. So I came to Clemson under biology, thinking I would go into med school. But then freshman year, I found this program, and I realized how I could help people and make a difference in the lives of others. So I really decided freshman year that this is what I wanted to do.
I was initially attracted to the program. I was coming into Clemson. As a freshman, I wasn't exactly sure what I wanted to do, so I found the program online, and it was a way to get a 4-year degree, a bachelor's degree in health science, but also have that opportunity to have the clinical experience and interact with patients and not only impact their healthcare, but impact their lives as well.
First couple of months in the program were kind of stressful, just due to the fact that it's a small program, so it was competitive. We started with a class of, I think, 16 or so, and only the top 10 from there were able to move on to the second semester.
Going through and learning all the material, it was extremely overwhelming, but at the same time, like, you just kept wanting more of it. So that's when I knew, I was like, this is exactly where I want to be studying, and this is exactly what I want to be studying.
My experience was little to none at the beginning. I didn't even know how to hold the probe. I have just learned so much book knowledge and as well as technical skills with scanning.
I had a situation where I could go down to the OR and all of a sudden, as soon as we kind of get in spot and everything, can get our probe down, the patient just codes. And so it's that point that they started doing, CPR and everything. And so they kind of got them stable again. And it was just kind of the surreal moment of, these people are giving it everything they have for this one person, So.
I feel very fortunate in that the 7 of us are very close, and we don't just hang out for class. We go to football games together, we tailgate, we go out for birthdays and stuff like that. So I feel like I've made some lifelong friends in this program, which has been great.
We're with each other so much, and we're actually practicing scanning on each other before we go out into the clinical field. And that's just given us great practice because we get to see the normal anatomy before we're thrown out into the clinical field, seeing that abnormal pathologies and people who are very sick.
During the junior years, really when we made these bonds. We have our own group text, we're just always sharing stuff, our experiences back and forth. We help each other study, and I just think that is an asset to the Clemson CVT program because they keep the size so small, and so you really do get to know all your classmates.
Everyone in our class and our professors has given so much support and encouragement and even on days when you didn't realize it was there, it was always there.
Vaughn, Mary, and Eric, they'll talk about becoming family, and you might think, oh yeah, whatever, but it's really true. They have become my second family. They have helped me through not only the clinical side and the schoolwork and things like that, but they have also helped me through realize who I am, helping me be confident in my skill.
I don't know what I would have done without them. If they had been any other people besides themselves, I wouldn't have made it, because they're probably the most reassuring, and they just build your confidence up so much, and they never let you quit or let you feel like you're behind.
You get more one-on-one care, and so the kind of one-on-one style that you have here can be transferred to when you're actually bedside with a patient, because really when you get out on your own and have a job, it's just you and your patient at the time.
You learn how to communicate effectively, you learn how to have teamwork, team building, you learn just overall kind of who you are and why you're doing what you're doing.
I feel like I've gained so much leadership experience. We have this program called MedX during the summer that we as students head up, and so we're in charge of it. We have to make sure we plan the daily activities and the information that we're going to teach the students, and I feel like that has really helped me professionally because now I do have that experience being a leader in that position.
Professionally, I've learned how to interact with a ton of different people, learned how to interact with people from all walks of life, not only preceptors but patients as well. And personally, our faculty and our teachers have pushed us to experience and learn more than we ever thought possible.
So my future plan is to ultimately become a pediatric cardiac sonographer. So that's definitely prepared me, one, from that echo perspective, but also introducing me to that field.
I actually just got a student sonography job with GHS in the vascular lab here. And so I'm really looking forward to cultivating that career and hopefully turning that into full-time once I graduate.
Eric, Mary, and Vaughn in the program itself have really just kind of given me opportunity to practice doing job interviews, so I'll apply and hopefully have a job.
They have taught us how to scan, they've taught us how to interact with patients and interact with coworkers and colleagues, so I feel extremely prepared to go out into the workforce, to interview, to scan well, and to hopefully land a job.
Right now, I actually just got a PRN job with the vascular lab at GHS, so my future plans will hopefully be a full-time job.
I really would like to get a job in the sonography field in either echo or vascular, or maybe even a job that allows me to do both modalities. I really feel that this program has allowed me to build my skills, and I feel very prepared to go out into the medical field and get a career.